So welcome to our presentation on polygraph under pressure, a trained individual manipulating physiological responses. So polygraph tests are widely used in criminal investigations, pre-employment screenings, and security assessments. However, some individuals are capable of manipulating their physiological responses, making it difficult for examiners to detect deception. So in this video, we will discuss how trained individuals beat polygraphs, the factors affecting test accuracy, and possible solutions to improve reliability.
So, polygraph tests work by measuring physiological responses that are believed to indicate deception. These include changes in heart rate, blood pressure, respiration, and sweating. However, because these responses can also be influenced by emotions, medical conditions, and external factors, polygraphs are not always reliable. When a person deliberately manipulates their bodily responses, it can lead to inaccurate test results.
One of the most common techniques used to manipulate polygraph results is psychological control. Trained individuals can condition themselves to stay calm even when lying. They might focus on mental distraction, suppress nervousness, or use relaxation techniques to regulate their psychological responses. Since the polygraph relies on detecting stress-related changes, a person who has mastered self-control can reduce their chances of being flagged as deceptive.
Even the most advanced polygraph cannot be fully effective if the examiner lacks the necessary skills and experience. A poorly trained examiner may fail to recognize signs of countermeasures, rely too much on the polygraph readings without considering behavioral cues, or misinterpret psychological changes caused by non-deceptive factors. Without proper training, an examiner could either falsely identify a truthful person as deceptive or fail to detect someone who is lying.
So to address these challenges, we must improve the way polygraphs are conducted. And here are some key solutions. Number one is better examiner training. Examiners should be trained to recognize to counteract deception techniques, including unnatural breathing patterns and subtle muscle movement. Number two, multiple lie detection methods. Polygraph tests should be combined with other techniques, such as voice stress analysis, behavioral observation, and cognitive-based questioning. Number three is improved testing techniques, extending test durations, randomizing question phrasing, and establishing a strong baseline for comparison that can make it harder for deceptive individuals to maintain control over their responses.
Through our analysis, we've learned that polygraphs are not foolproof. Trained individuals can manipulate their physiological responses, making it difficult to determine deception accurately. However, with better examiner training and the integration of multiple lie detection methods, the effectiveness of polygraphs can be significantly improved.
In conclusion, while polygraphs are a useful tool, they are not immune to manipulation. Understanding how trained individuals beat the system allows us to develop better strategies for detecting deception.
Thank you for watching our presentation. We hope this discussion has provided valuable insights into the strengths and limitations of polygraph examinations.